Have you ever been locked inside your house on a rainy day and wished you were at the beach? This sunshine vitamin, commonly known as vitamin D, is produced when sunlight hits our skin, especially on sunny days in summer. You may not have heard of anyone you know who has fallen and fractured their bone. Thanks to vitamin D, these problems cannot occur. Vitamin D is more than just a bone-building vitamin. It also helps your immune system. But does it do it? Well, today we're going to discuss what vitamin D is, why it's important, and why it helps to boost your immune system. Let's get started. Vitamin D, also known as calciferol, is a fat-soluble vitamin belonging to the D1, D2, and D3 families. When exposed to direct sunshine, your body naturally generates vitamin D. Certain meals and supplements can also be used to guarantee appropriate levels of vitamin D in the blood. Particularly if you have a deficit, vitamin D may help to prevent respiratory infections or lessen their severity. Some medical professionals advocate using vitamin D supplements to improve your immune system. A number of critical but beneficial activities are carried out by vitamin D, such as calcium, phosphorus absorption, and immune system function. In the United States as well as across the world, many individuals do not obtain enough vitamin D. To find out if you're receiving enough of this vitamin, you must undergo a costly blood test. New research continues to demonstrate the importance of this vitamin to human health. Calcium and phosphorus levels in the blood are maintained by vitamin D. Your bones are strengthened by these two nutrients. In the absence of vitamin D, your body can only absorb a tiny quantity of calcium from your food and a little more than half of the phosphorus from your diet. When your body does not absorb enough calcium and phosphorus, your bones become fragile and can shatter easily. In the United States, the Institute of Medicine's 1997 and 2010 guidelines for vitamin D consumptions are: birth to 1 year, 400 IU per day, that's 10 micrograms. Between 1 and 70 years, 600 IU per day, that's 15 micrograms. Over 70 years, 800 IU per day, that's 20 micrograms. Pregnant and nursing women, 600 IU per day, that's 15 micrograms. So, to reduce vitamin D deficiency, you may ask, what is the best source of vitamin D to intake? The main source of vitamin D comes from exposure to the sun. The American Academy of Dermatology advises that we obtain vitamin D from foods and supplements rather than UV exposure because of the risk of skin cancer. Alternative sources like certain forms of fatty fish, such as herring, mackerel, salmon, tuna, and sardines, are rich in vitamin D. It is also found in egg yolks, cheese, and cow liver, although at much lower levels than in other foods. Certain types of mushrooms, particularly those that have been exposed to UV radiation, contain vitamin D. Besides food, vitamin D supplements can be taken. Aside from pills and capsules, vitamin D supplements are also available in the forms of gummies, liquid, or chewable tablets. In addition to this, cod liver oil is still in use. Vitamin D2 and D3 may be found in supplements and fortified meals. For optimal absorption, vitamin D3, cholecalciferol, is the recommended form. Vitamin D has a vital role in immune function, and a lack of it increases your vulnerability to infection. According to Dr. Jacqueline Tolentino of Parsley Health in Los Angeles, low serum levels of calcidiol, which is a form of vitamin D, are linked to increased susceptibility to infections such as tuberculosis, influenza, and viral infections of the upper respiratory tract. He also said that vitamin D's main function is to help activate T cells, also known as killer cells, in the body. T cells are able to detect and destroy foreign pathogens such as viruses. As a result, vitamin D is especially important for maintaining a healthy immune system that can fight off foreign pathogens. As we know, coronavirus affects the respiratory system, but researchers and clinicians do not yet understand how vitamin D increases your chance of contracting COVID-19. as vitamin D is believed to boost the immune system, which might help protect you from a wide range of diseases and conditions. Although it's difficult to separate the effects of vitamin D and calcium because of the way vitamin D affects calcium, observational studies and preliminary lab studies suggest that higher vitamin D and calcium intake and status may be associated with low cancer risk. According to a meta-analysis published in American Journal Preventive Medicine, people with the greatest levels of vitamin D had a 50% decreased risk of colorectal cancer. On the average, 1,179 women over the age of 55 were given calcium, vitamin D3, or placebo throughout the course of 4 years. Women who took calcium and vitamin D, as well as those who had greater vitamin D levels at the start of the trial, had a considerably lower risk of all cancer types combined. Winter is when the flu virus causes the greatest sickness, leading some researchers to believe that vitamin D levels may be connected to influenza. Winter is the time of the year when vitamin D levels are lowest. In a research published in the American Journal of Clinical Nutrition, almost 340 youngsters were randomized to receive a daily vitamin D supplement, 1,200 IU, or a placebo over the winter. According to observational studies, low vitamin D levels are associated with an increased risk of respiratory infections. Besides all the good news, there are also alarming effects you should consider before consumption of vitamin D. Vitamin D is fat-soluble. As a result, unlike vitamin C and other water-soluble vitamins, it can accumulate in the body and induce hazardous effects if eating in excess. Too much vitamin D can lead to excessive blood calcium levels, hypercalcemia, which can cause calcium deposits in soft tissues such as the lungs or heart, disorientation, renal damage, kidney stones, nausea, vomiting, constipation, weight loss, and low appetite. Taking vitamin D and calcium along with thiazide diuretics might lead to excessive calcium levels in the body, which should be avoided. Because it may interact with the medicine, those using calcium channel blockers shouldn't take vitamin D or calcium, except under the care of a doctor. That's all for today regarding the benefits of vitamin D for immune system building. Did you check your vitamin D level recently?
Thanks for watching our video. For more healthy experiences, subscribe to our channel and keep yourself updated by pressing the bell icon.